Neonatal urine output. The newborn faces a transition or beginning of the life with a difficult situation starting the mother's breast. First 2 to 3 days you have colostrum. They are low in amount but very rich in the nutritious and very rich with antibody. So it takes time to establish a spontaneous, the relationship between breastfeeding between the newborn and the mother. So and the neonatal kidney is immature. They have less tubular glomerular function. GFR is low. How much? 10 to 15 ml per minute per 1.73 meter square up to day 3. Up to thereafter, now it is how much? Gradually it improves. By 2 weeks or so, it is 35 to 45 something, and at 8 weeks, 2 months, it is 80 something. At 1 year, it is around 90 to 100. That is up to 2 years. One neonate, the infant have low GFR because of the renal immaturity. So this is possible, and urine output is little bit low in the first 1 to 2 days something, but most of the time, your 90% of cases you have urine satisfactory urine output by 48 days. If not, go on thinking other way. The not a single drop after 2 days, you do one ultrasound, see whether bilateral renal agenesis is there or not, and then you see the established satisfactory breastfeeding is established between the mom and the infant. See otherwise the infant neonate is are able to suck or not. If they are not, you wait up to 2 days. And other way of assessing the neonatal renal function is creatinine. Creatinine is fallacious in the newborn. In the first few days, you have maternal creatinine in the newborn, so you do not know the exact newborn creatinine, and there are not much lab data to identify the neonatal AKI. Good amount of time you have some amount of further renal injury in the top of the less maturity. So apart from that, infection and sepsis and other issues, they are to be looked upon over here. But the good amount of time, majority of the 99.9% something, they have in the your healthy neonate, you have the eventual the good outcome. The urine passes within few hours or even 1 or 2 days, and then you have the child is feeding well established. Usually a newborn passes how much? 10 to 20 urine now it's possible in a day, because again the tubular immaturity, the child cannot retain the urine, and ultimately decreases to normal 4 to 8 times per day when the child grows.